Hi, I'm Michelle Servant, and I'm a student at Maryville University, and I'm going to be performing a head-to-toe assessment on Carson here. He's my student. The first thing we did was have him empty his bladder, put on a gown. We did vital signs, height and weight, and also the distant for vision for the Snellen chart. The first thing I'm going to do is assess his head and face and his skin on his head and face, which it all looks within normal limits. It's a good color. There's a few blemishes, but that's normal for his age. Fix this here. Okay. Next thing I'm going to do is check his ears, external ears and eyes to make sure that they're symmetrical, and I see that they are symmetrical, aligned with his face. Next thing I'm going to do is check his skull for any imperfections. Okay. Next thing I'm going to do is check neurological. Bless you.
Thank you.
Okay. Smile. Okay. And lift your eyebrows. Okay. Close your eyes tightly. Clench your teeth. Like this. Okay. All right. Next thing I'm going to do is palpate the head and his scalp and his hair and facial bones. Okay. So his hair looks normal. Facial bones are all normal. And his hair, I don't see any dandruff or any flaking or anything like that. Next thing I'm going to do is check for TMJ and his sinus regions. Open your mouth all the way and shut. Okay. Don't feel any popping. And I'm going to check sinuses here. Any swelling. I don't feel anything. Next thing I'm going to do is test the sensation, light sensation. Okay, go ahead and close your eyes and just tell me if you feel this on both sides.
Yep. Yep. Yep.
And is it even?
Yes.
Okay. This side?
Even. Yes. Yes.
Great. Oops. Okay, next thing I'm going to do is examine his external eyelids, eyelashes, and his sclera. Okay, so go ahead and shut your eyes, and they all look fine. No puffiness, no redness. His eyelashes extend out, and his sclera looks white. Open your eyes. Open your eyes, please. White, no redness, no drainage or anything like that. I'm going to also palpate his lacrimal apparatus and his assess his pupillary response. Okay. For some reason my light is not working, but I know how to do it. I'm just going to go ahead and demonstrate it. So lacrimal apparatus here, no swelling, and then to check his pupillary response, I'm going to shine a light in the back. Okay, and then this side. Okay, perfect. Next thing I'm going to do is the eyes cover and uncover test, and I'm going to also inspect his red reflex with the ophthalmoscope. Okay, so cover this eye there, and let me know when you can see those fingers.
No.
Okay.
No. No.
Okay, the other eye side.
No. No.
Straight ahead, please.
No.
Okay, good. All right, and I'm going to. All right, good. All right, next thing I'm going to do is inspect his extraocular movements. All right, so I'm just going to have you look straight ahead and follow this. Don't move your neck and follow this with your eyes. Very good. Okay, next thing I'm going to do is palpate his ears and inspect the alignment and the placement. So his placement is good. In alignment, I'm going to assess his auricle, and I'm going to his pinna. Those are all fine. The next thing I'm going to do is going to do a whisper test. If you want to cover that your right ear, I'm going to whisper into your ear, and you just repeat what I say.
Orange.
Okay. And the next thing I'm going to do over on the side.
Apple.
Perfect. Next thing I'm going to do is the tuna fork. Both ears.
Yeah.
Okay.
Yeah.
Okay. Perfect. Okay. Next thing I'm going to do is inspect his ear with the otoscope. All right. Back in. Okay. I'm assessing his eardrum. Everything looks clear and okay. Okay, perfect. Okay, next thing I'm going to do is check his nose structure, which everything appears normal, no breaks or cracks. I'm going to go ahead and look up in his nose to assess his septum and determine the patency of each nostril. Okay, so everything looks good. All right, I'm going to have him cover his nose to assess. Okay, now breathe in and out. And then the other side. Okay, the next thing I'm going to do is look inside of his mouth and palpate, or not palpate, but look at his tonsils, uvula, teeth, his gums, soft palate, hard palate. Okay, so open up. And also I'm going to check his gag reflex. Okay, so teeth are all there, a little bit yellow in the back, but otherwise all there, not missing. All right, everything looks good on the hard and the soft palate. I'm going to check his gag reflex. Go ahead, stick your tongue out. Okay. And then I'm checking his uvula, his tonsils. Let's check his gag reflex. Okay, it's there. Perfect. All right. I'm going to now check his neck for symmetry, the smoothness of his neck, his thyroid, and JVD. Okay. So I don't see any JVD or feel any JVD. I'm checking for the smoothness. It is very smooth and it's symmetrical. And I'm going to check his. I'm going to palpate his. I can't talk right now. Thyroid. Go ahead, swallow. Okay. And then let's see here. Going to listen to his carotids, both sides. And then I'm going to listen to his thyroid. Very good. Now I'm going to palpate his lymph nodes from the top here down to under his axillary. Okay, so I'm going to start here. Come back. Come down. Supraclavicular. Okay, and then go ahead and pull this down here. Pull that down the cervical chain, and then I'm going to check underneath here. Okay. All right, perfect. Okay, the next thing I'm going to do is, I'm going to, I already auscultated the carotid and the thyroid. The next thing I'm going to do is check his hands, his upper extremities, basically. Okay, so go ahead and hold those out. Okay, I'm checking the smoothness of his skin. I don't see any bumps, any kind of abrasions. Turn it over. Okay, and then go ahead and squeeze my hand. There you go. Okay, squeeze this side. I'm checking cap refill, less than 3 seconds. Nail beds are pink. Okay, I'm going to check the brachial pulse. Good. And I'm going to check the radial. Okay, and the brachial. I'm going to check the reflexes as well. Hold that out. Okay. Okay. And let me check this side. Okay, very good. The next thing I'm going to check is his shoulders. Go ahead and do a shoulder shrug. And the one thing that I forgot to do earlier was check his neck range of motion. So go ahead and I'm going to have you do it yourself. Neck range of motion, back and forth and back like this and that. Okay, good. And then I'm going to have you push against my hand. Very good. Okay, very good, very good. Okay, the next thing I'm going to do is inspect his thoracic configuration. Okay, so I'm going to have you stand up and turn around. All right, so I'm going to go ahead and check. That hurt? Okay. That hurt? No. Okay, I'm also checking his spine here to make sure that there's no C or S curve. Okay, very good. All right, go ahead and turn around. All right, I'm going to go ahead and, oh, hold on, turn back around. I'm going to try to do this in order. Yeah, turn back around this way. Yeah, sit back down, sorry. I kind of got out of order. I'm going to check for tactile test. Go ahead. 99. Okay.
99.
Mm-hmm.
99.
Perfect. Okay, the next thing I'm going to do is check. I'm going to listen to him in the front here. Palpate. Okay, hold your arms out for me. Deep breath. Okay, now I'm going to check his I'm going to listen to. Okay, perfect. Okay, the next thing I'm going to do is inspect your abdomen. So if you can lay down.
On my back.
Yes. Thank you. All right. Time here. I'm going to first look at the abdomen here to make sure that everything looks good, skin looks good. Okay. I'm going to listen. Okay. Next thing I'm going to do is I'm going to check for the liver. I'm going to start here. Okay, it's there. Okay. I'm going to do the same for this one. Okay. I'm going to go ahead and okay, perfect. The next thing we're going to do is sit up for me, Carson. Okay. Turn around for me. All right, I'm going to okay, take in a deep breath for me. This way. I can never remember. Okay, deep breath. Go ahead and stand up straight for me, please. Kind of lean forward a little bit for me. Now lean forward for me. Lean your back, lean forward. Bend over a little bit. Yeah, there we go. Okay, deep breath. Okay, okay, stand up straight. Now I'm going to check this tactile thermometer again. 99.
99.
Okay, 99.
99.
99.
99. 99.
Okay, good. All right, turn back around. Okay, sit down. Okay, I'm going to check his skin, which everything looks great. His hair is evenly distributed. His muscles are well defined. I'm going to check pulses here. This is the popliteal. Okay, bring your leg up for me. Okay. Posterior. We have that one. And the pedal. Okay, we have that one. Oh, sorry. Okay, all right. Okay, this actually concludes my examination.